My name is Martin Nielsen, and I'm the CEO and co-founder of IAH Wellness. The reason behind the project, when we started, and still is the main purpose, is helping people. Helping people that haven't been able to find adequate help, or helping people that haven't been able to receive adequate help. The reason why we have focused on Lyme and co-infections is because Lyme is becoming the epidemic of the 21st century. And the resources being distributed to research Lyme is not enough. So any help that we can bring to the table is more than necessary. Lyme is a very old infection, basically as old as human beings on the planet. As long as there have been animals and people or human beings living closely, we've been bitten by ticks and we've been transmitted the disease of Lyme. But it was actually not until the 1970s in a small rural community in Connecticut in the US that it became aware to public that something was affecting a large amount of children, giving them a syndrome called rheumatoid arthritis, which is very rare. So a lot of research was put on that domestic area to find out why is this happening. And in 1982, a doctor called William Bordorfer, he discovered the reason behind that outbreak, and it was a small bacteria called, well, he named it after himself, Borrelia burgdorferi. But the commercial name was named Lyme. A person that is infected with Lyme has a huge amount of symptoms. So it's very difficult to say exactly what are the most common symptoms, but there are certain symptoms that we might say that these are the traditional ones, and those are joint pain, nerve pain, muscle pain, Bell's palsy, where you lose control or you lose muscle activity in one part of your face, fatigue, and cognitive impairment. Today, to diagnose if the person has Lyme or not, there are two tests that are being performed, both in laboratory. They're either an indirect test or a direct test. An indirect test is called a serology or T-cell test. That means that the laboratory is looking for the immune response reaction. The direct test is pinpointed directly at the infection. But there are no exact tests today. So we always recommend everybody that has a test being taken to take both an indirect and a direct test. And then you compare them both. And even if those wouldn't give a perfect match, we have to look at symptoms. Because Lyme and co-infection are symptom-based infections to treat as well. The prevalence of Lyme in the Northern Hemisphere is very high, with an epicenter in the northeast of the US. In Europe, we have a high prevalence in the northern part of Europe, from northern Spain up to the Scandinavian countries. So basically, anywhere in the world where you will find a green forest, you will find a Lyme-biting tick. I would say that one of the big misconceptions regarding Lyme is the absence or not of the classic bullseye rash. Not having a bullseye rash does not mean not having been bitten by a tick. Basically, less than 30% of people being bitten by a tick will develop a bullseye rash. So it's not an acronym to having been bitten or not. Unfortunately, the medical knowledge about Lyme and co-infections varies hugely between different countries, and also the treatment options. There are many countries in Europe, for example, where they don't even recognize Lyme being domestically present, even though there are ticks. And in other countries, the treatment options are very scarce due to the restrictions of the treatment options. So that's a big problem in the Lyme community today. But there's also a huge amount of co-infections. That's why our treatment protocol is called LACY. It's based on Lyme and co-infections. And these co-infections that are also very present in people with Lyme are Babesia, Bartonella, Ehrlichia, anaplasma, mycoplasma, and some of these infections are much more highly virulent than Borrelia. So they actually impose a much higher threat to the human being. The LACY protocol is an acronym for Lyme and co-infections because we have to stop talking about Lyme. It's Lyme and a huge amount of co-infections, and that's why we call it LACY. It's based on 4 different phases. They all work horizontally. It's based on IPT, probiotics of human origin, IV immunotherapy, and herbal treatment. And the herbal treatment comes from, it's a summary of the Buhner, the Bowden, and the Byron-White protocol. The difference between the LACY protocol and other protocols is that we work it in 3 different stages. There's a pre-treatment before the patient is coming to the clinic, where we prepare gently the immune system and the body to be able to receive the rather harsh treatment at the clinic. Then you have the on-site clinic treatment, which is for 6 to 8 weeks. And then once done at the clinic, there's a post-treatment of between 9 to 11 months where we keep on treating the client or the patient, but he's back home. I pinpoint one of the cases we've had when a patient arrives in a wheelchair because he is unable to stand up and walk more than 30 meters without getting a cardiac arrhythmia. And now 3.5 months into his post-treatment, he's able to walk 10 kilometers every single day, and he's back into his daily life routine and working like he hasn't been doing for almost a year. I would say that that's a success. The approach that we have at the clinic might differ from other clinics in the sense that our ratio patient-staff is very, very high. We only take right now 6 patients a month. That gives the ratio of care per patient very high, but that's also the philosophy of the clinic and the treatment protocol, that we give a very humanized protocol treatment and approach. If a person believes or thinks or have doubts about having Lyme or even have been diagnosed, I would say that the most important thing is time. Don't let time go by, because by the day it gets more complicated. So for anybody with a doubt, contact us and we will set up a video call and we will try to find a solution as soon as possible, because time is of essence. That would be what I would say is the most important in Lyme and co-infection strategy treatment.